Good morning. I'm Carol Mentor. I'm the Community Outreach Coordinator with Commonwealth Autism Service, and thanks everyone for coming this morning, both today and through the webcast. We're very excited to host a presentation of Senate Joint Resolution 330, especially through the webcast, which gives a nice alternative to traveling this morning. At the end of the presentation, we're going to have time for questions. People who are joining us through the webcast can email questions to me at cmentor@autismva.org. It's CMINTER@autismva.org. If any of the questions are not able to get answered this morning and they're emailed, I will forward those questions on to Jamie for her to reply to those individually. For those of you that are here this morning, just a couple of household items to go over. If you need to use the restroom, it's out the double doors here. And I'd ask this time for you all to take your cell phones out, make sure they're on vibrate or have them turned off. At this moment, we'll have our President and CEO of Commonwealth Autism Service come up, John Toscano.
Thanks, Carol. I want to follow up Carol's welcome by also offering a welcome to everyone here in the studio this morning, as well as the folks joining us by the webcast. We've got more than 60 people in total, a handful here in the studio. Cold, rainy morning here in Richmond, Virginia. I'm not sure where everyone else is logging in from, but hopefully your weather is better than we're having here. And I want to say a special thank you to the folks here at the community idea stations for helping us make this happen today. At CAS, we're privileged to be hosting today's presentation by Jamie Hoyle from the Joint Commission on Healthcare, sharing her findings from her study commissioned by Senator Ralph Northam via the Senate Joint Resolution 330, Needs of Individuals with Autism Spectrum Disorder Transitioning from Secondary Schools. We were appreciative of the opportunity to have played a role in this study, and we're optimistic that the recommendations will be embraced and have a positive impact in the lives of individuals with autism and their families, serving as a vital subsection of the roadmap laid out by the JLARC study some 4 years ago now. We want to begin today's presentation with a brief video entitled Autistic and Aging Out that poignantly captures the challenges faced by individuals with autism and their families in this crucial stage. So our tech folks hopefully will load that up, and the folks in the studio will be able to see it as well.
We stylized the drawing, decided on a horn to the devil with courage.
Back to the regular way. I like to eat. I like to eat apples and bananas.
My son Andrew, he was diagnosed with autism when he was 27 months old. So we've been doing this a long time. Come here. What did you do in school today?
Miss Pike.
She wasn't there, right? Miss Marianne was there.
Miss Maya.
Did you go swimming?
That's swimming.
Was that fun?
That's not fun.
Yeah? What else did you do today?
Take a snack.
What are you going to do tomorrow?
Do school.
Mm-hmm.
Apples and bananas. Now, oat.
Oot. 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 I keep a creek. News. Dog.
Are you almost ready for bed?
No bed.
No, not tonight? No sleeping? He will go to school until he's 21. Then it's a whole new world for us. You know, other 18-year-olds are driving cars, they're figuring out where they're going to go to college. He's nowhere near any of those capabilities. What do you say?
Smile.
autism ranges from all the smart people that run major Silicon Valley companies, and Einstein, who had no language till age 3, to somebody who's going to remain nonverbal, that's very, very handicapped, and is going to have to live in a supervised living situation. It's a very, very broad disorder. People like me are maybe half of the people on the spectrum. And then you have kind of a moderate range in the middle, where they might be able to go to restaurants by themselves, do a simple job, but need some supervision where they live. And then you have ones that need to live in a totally supervised living situation.
Come on.
Monday, March 18th, 2015 day.
Great. That's absolutely correct. Come on, let's go. Time to get up. Go pee-pee. Let's go pee-pee. I'm sure you have to. Come on, honey. Andrew's dad and I divorced. There was a lot of reasons, the strain and stress of caring for Andrew, as affected as he is, took a toll on the marriage. Okay, that's enough for today. Okay, turn on the water. Get your hair wet. Put your head under, get your hair wet. A lot of it is like Groundhog Day around here. A lot of it is the same thing over and over. Andrew does like routine. He does want the same things a lot. And it's been very difficult for him to gain any independence, even in his morning routine.
We've got to start working on transition. And one of the big things is work skills, especially on the higher end of the spectrum. And then things like how to do banking, shopping, all the things that you'd have to do to live independently. And we need to start working on those things long before they graduate. I want to start working on this before they're 18 years old. And working with a person with autism, you've got to just coach them like coaching somebody in a foreign country, how to behave in different situations.
All right, Rob, we need, Jason, 2 more chairs on the other side of the table, big man. When they first met Andrew, he was 6 years old, and he was this cute little light brown haired, handsome little boy. And over time, he became a young man, a teenager, and then there were more things to learn about becoming a teenager. And now I'm teaching him what it's going to be like to be a man. At 21, he's going to be a man. What do you need to add it up? We need a calculator. Let me just try to get everybody a calculator. And to have one right here. Here you go. Do your work so you can add everything up yourself. So, unless you want to, Andrew Rogers already ahead of us here. He's cooking with gas today. Jason, what do you need? Autism is like a big rainbow. Everybody is different, and behaviors are from major to minor. And so they're all very different, have to be taught in very different ways. So you can't just lump them in. You know, you have to look at each person's needs individually and assess them from there.
Ready to do some swimming? Yeah, let's swim. Let's go to the end. Let's meet up with action.
All right, ready, everybody? Dig in. Let's go.
I'm thirsty. I want a drink.
Andrew's a light over there. One. There you go.
I'm lonely. Can somebody come sit with me?
I'm already sitting with you, buddy. How are you? How you doing, bud? I'm eating my lunch. You have to ask me.
I'm hungry. I want to eat.
Here you go, big man.
Boy, house! With boy, house this neat.
Well, basically, the most general thing about autism is the social circuits in the brain aren't hooked up. So instead of learning social things just sort of by instinct, you have to be taught. You have to be methodically taught. This is how you shake hands. This is how you greet somebody. If you tell that same story more than 3 times, that's going to bore somebody. They've got to just be taught.
Hello, Andrew.
Hello, Andrew. Miss Penny.
How are you today?
How is it, Miss Penny?
I'm fine. How are you today?
How today?
How are you today?
Andrew.
How are you today?
18.
How are you today? I'm fine.
As Andrew approaches age 21, we start to think about him aging out of school and what will he do next. I don't see it right now that Andrew would ever be able to live by himself. He appears to always need a caretaker. To imagine what life will be like in 30 or 40 years is kind of difficult. We kind of take it one day at a time around here.
Most people my age have people taking care of them. I'm still taking care of my son and trying to create what he and other autistic people will need once they become adults. So His Royal Highness is finally up. This is my current major cause to figure out how to keep him in his own apartment with the supports that he needs, with somebody supervising people and hiring people as they leave and training them and making sure that my son is taken care of properly. There is no agency that I know of that's doing that today, and I'm hoping that that agency will be created before I am no longer here.
But yeah, now you know what I mean.
And I think work is very important for him and for most people because it sets up a structure, and the structure is what's really important, more than the actual job.
Come on, put a play with you. There goes.
Lyndon wants to do a lot of things and go a lot of places, and all that costs money. So I told him if he does more work with his mosaics, he can make more money, and then if we have enough money, we can do whatever we want to do.
Go that way. 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 Go the 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 way. Come closer to him. That good. Back. This back anyway. Yeah.
5 more minutes and then we're going to sleep. I would love for him to have a productive work life. I would love for him to be happy. I would love for him to have some sort of relationship to keep him happy. But honestly, I don't know that any of that is realistic for him. He'll physically be an adult, but he'll always have a lot of child in him.
Black and white.
Black and white?
So his shoes color.
Black and white. Move down.
So
There you
his
go.
shiny black and white shoes.
Oh, shiny black and white.
Was shiny black and white.
Are you tired? A little bit?
A little bit.
Okay, well, get some rest. Okay? I'll see you in the morning.
I see you in the morning.
Have a good night.
Have a good night.
I would also be remiss if I didn't thank the folks at Narratively who also gave us permission to use that video. One of our staff sent it to our attention a few days ago, and I thought it was a very appropriate introduction to our topic today. So without further ado, it's my pleasure to welcome Jamie Hoyle, Senior Staff Attorney, and with the Joint Commission on Healthcare, who will be reporting on her findings from SJR 330. Jamie?
Thank you, John. Let's see if I get situated. I have to say before I start that I have really enjoyed, at the Joint Commission on Healthcare, we get all sorts of different studies. And this one was new to me, new area. Education, autism, all of it was new to me, and I have really enjoyed it. And that's not always the case. So I think it has stuck with me. So I have to be able to be here and talk about it. Wait, I went the wrong way. All right. As was mentioned during the last session of the General Assembly, Senator Northam introduced Senate Joint Resolution 330, and it passed. And it directs the Joint Commission on Healthcare to study the service needs of individuals with Autism Spectrum Disorder that are transitioning from public and private secondary schools. Specifically, we're to look at the needs related to housing, employment, and day support services. This is the agenda. Just focus. Most of you are aware of the background, but I will go over it anyway, just in case. Autism spectrum disorders are a group of developmental disabilities characterized by atypical development in socialization and behavior. There are many levels of functionality along the spectrum. The associated impairments affect multiple areas of an individual's life across their lifespan. These include education training, employment, housing, and healthcare. Now this slide, I need to give credit to Natalie from JLARC. She recently used this to update her slide from her 2009 study, and it obviously shows the dramatic increase in diagnosis of children with autism spectrum disorder. And I could have included another slide just to straighten that there doesn't seem to be any leveling off of the diagnosis in the near future. And this next slide is the prevalence of ASD in Virginia. So it's looking at 100 in 2011 that were transition age. And now, in 2012, 2013, I wrote this down, it is about 4,500, roughly, in the transition age. This is daunting, considering the level of services for adults. And as the importance of transition is to prepare the kids to live independently as adults and take advantage of whatever supports are needed. With better interventions and supports across the lifespan, a person with ASD can become more independent. The primary needs of adults with ASD are, or could include additional education or training, adequate income to be self-supporting, housing, which may involve non-supported independent living, group home, congregate care facilities, and then also healthcare services. Often a major shock for kids and families is that adults with autism spectrum disorder age out of the entitlement system. Services are guaranteed through the age of 21 if they are eligible for special education. However, when they reach over the age of 21, they are no longer eligible for entitlement services. They must voluntarily seek out services and meet eligibility requirements for the services that are already limited in availability. And coming on the heels of limited availability of adult services, it should be noted that the average costs, lifetime cost to care for a person with autism spectrum disorder is $3.2 million. That was based on a 2006 study from Harvard School of Public Health. Okay, this next slide shows the public funding programs for adults with autism spectrum disorder. And the major problem with these programs is that Medicaid waivers do not guarantee access to needed support. This was a finding of the 2009 JLARC report. Enrollment is capped under the waivers. The waiting list exists. The only most severely disabled meet functional needs eligibility, and case management services are not widely available. Our review indicates that this continues to be true. The good news is that the Department of Behavioral Health and Developmental Services will expand case management capacity within community services boards, and they are planning jointly with the Department of Medical Assistance Services for waiver changes over the next 2 years. They will create 4,000 waiver slots by June 30th, 2021. They will move to a needs-based waiver based on a level of functionality and not diagnosis. And they will recommend needed rate changes to serve those with the most complex needs and align incentives. In Virginia, the IEP process must include transition planning by age 14. According to national studies, students with autism spectrum disorders have less favorable employment outcomes than students with other disabilities. Young adults with autism spectrum disorder are less likely to have ever lived independently after high school than adults with other disabilities. And data from Virginia reflects the same. This is the data on the next slides that we got from the Virginia Department of Education. It should be noted that they compare ASD with all other forms of disability. So it's not just comparing autism against autism. I can get you those numbers if you want. So this is looking at their post-secondary training and education, and employment numbers. The 2009 JLARC report also addressed transition services. They found that transition planning and services may not address the unique needs of students with autism spectrum disorders. They recommended that the Virginia Department of Education develop transition guidelines, create transition specialist positions, expand vocational and life skills training. Since their report, the Virginia Department of Education has issued guidelines for transition planning rather than policy regulations in order to afford flexibility in meeting the varying needs of individuals with ASD. Case managers have always been assigned to each person with an IEP. They have added transition coordinator staff to larger school divisions, and they have collaborative agreements between the local school and the local DARS field office However, it is the family's responsibility to invite other agencies such as DARS or CSBs to the transition meetings. Some of our findings related to transition, coordination and collaboration. That transition planning is still variable depending on where someone lives, in what school division, and the expertise and institutional knowledge of persons included on the transition team. There needs to be collaboration between the Department of Education and DARS, which is the Department of Aging and Rehabilitative Services, I forgot to say that, and CSBs are the Community Services Boards, to ensure adults with autism spectrum disorders learn about and access available community resources as they transition. Families have reported that often a DARS representative has not been included in transition planning. And families are not the experts on autism spectrum disorder and the community resources that are available. They should not have to determine which agency representatives attend initial transition meetings. We're looking at higher education. This slide shows you that the diplomas that are available through the Virginia Department of Education. And post-secondary education is a realistic goal that can be successfully prepared for during transition if the proper supports are in place. Employment provides the income to allow a person to live independently, and persons with autism spectrum disorder are employed at much lower rates than those with other disabilities, as this table indicates. Again, employment is a realistic goal for most if appropriate planning has taken place, appropriate level of supports are available across the lifespan. For persons with higher needs, training and services are available. They can look at segregated employment, sheltered workshops, or constant or intermittent oversight by a job coach. DARS. They are responsible for providing employment support for individuals with autism spectrum disorder if they meet the eligibility requirements. Examples of some of the DARS programs are the Woodrow Wilson Rehab Center, Life Skills Training Program, and Post-Secondary Education Rehabilitation Transition, or PERT. Steady increase in applications for services by people with ASDs. DARS has seen a steady increase in applications for services by people with ASDs. In 2012, there were 1,500 individuals on the waiting list. This has considerably grown since 2008. Individuals with autism spectrum disorder require higher levels of employment support to achieve successful employment, usually longer than 90 days allowed under the supported employment. It's difficult to gain access to long-term employment support services longer than 90 days, given that there have been funding cuts. Lack of such support remains a consistent complaint from individuals with autism disorder and their families. Since the JLARC report, DARS has been using its budget to improve vocational services for individuals in transition. They're currently operating under a federal order of selection due to insufficient funds. Eligible individuals who applied are placed on a waiting list according to disability categories. And some then choose not to even apply for services because of the order of selection and the waiting lists. Moving on to case management. Case management services only exist for adults enrolled in waivers or DARS programs. Programs that offer case management services are not consistently available to coordinate the care of Virginians with autism spectrum disorder. This was the finding of the 2009 JLARC report, and our findings indicate that is still the case. CSBs could take the lead in case management for adults with ASD, but they lack staff trained in the specific needs of individuals with ASD. And this is an example of some of the other employment initiatives, Project Search, and Employment First initiatives through the Department of Behavioral Health and Developmental Services. I'm going to looking at housing. So a major concern for the ASD community is the transition to housing, as affordable and accessible housing is inadequate in Virginia. Affordable housing requires income. Many persons with autism spectrum disorder are unemployed and receive SSI payments, which is typically too low to allow a person to afford housing. And that can also become a disincentive to finding employment. Currently, the housing options with adequate services are limited and expensive, and the current waiver system is based on diagnosis and acts as a barrier to persons with ASD in finding housing. Developmental disability waiver does not cover housing costs. The ID waiver covers in-home residential support in congregate facilities and congregate-sponsored services. Housing options could include living independently, independent living with supports, living at home with family, group homes, sponsored placement, and home sharing. The Department of Behavioral Health and Developmental Services current housing efforts in the Department of Justice Settlement. They basically require the Department of Behavioral Health and Developmental Services to serve individuals in the most integrated setting consistent with their informed choice and needs, and to include a term in the performance contract with CSBs to require case managers to continue to offer education about less restrictive community options on at least an annual basis to any individual living outside their home or family's home. They're also to assemble baseline information regarding the number of individuals who would choose independent living options, develop a plan to increase access to independent living, and to undertake an $800,000 rental assistant pilot in an effort to address these housing needs. In summary, it still remains difficult for families to navigate the system. Families continue to report that they do not understand waivers, options for financial assistance, employment, and housing. One of the goals of having the Department of Behavioral Health and Developmental Services as the lead agency for autism spectrum disorder was to create collaboration and coordination and provide the opportunity to address service gaps. I think they have done a lot, but there still needs to be more work. And so our policy options, where we always have a policy option, number one is always to take no action. Policy option 2 is to encourage the Department of Behavioral Health and Developmental Services to publicize its role as lead agency for autism spectrum disorder services and highlight the link to Commonwealth Autism Services for information and resources. Option 3, introduce a budget amendment to expand case management services provided by the Department of Aging and Rehabilitative Services to address increasing demand and enable more consistent involvement in transition planning. Option 4, introduce a budget amendment for Department of Behavioral Health and Developmental Services to include community services boards in transition planning and provide case management services for adults with ASD after the Department of Education is no longer involved. Option 5, request that the Department of Behavioral Health and Developmental Services work to improve collaboration between its agency, the Department for Aging and Rehabilitative Services, and Community Services Board for ASD-related services for adults, beginning with transition planning. Option 6, request that the Department of Behavioral Health and Developmental Services form a stakeholder work group to develop CSB staff competencies for providing case management to adults with ASD. Option 7, introduce a budget amendment to expand long-term employment support services administered by the Department of Aging and Rehabilitative Services. Option 8, request the Joint Legislative Audit and Review Commission conduct a follow-up to its 2009 report on ASD and consider our findings in completing its study. And this says we are accepting public comment, and obviously October 8th was yesterday, but we will accept them up until, I think I'll present them still at October 22nd meeting. So if you want to comment, you can send them to me up until the 21st. That's it. If you have any questions. Yes.
Thank you for your report. It's thorough, and you grasped a lot of the complex issues that we face in serving individuals with autism really effectively, so thank you. I think one of the challenges that individuals with autism and their families face is that CSBs, Community Services Boards, are not mandated to serve individuals with autism. There are some CSBs across the state who will serve individuals with autism who don't have a co-occurring intellectual disability because they see that as a part of their role in providing a community service. There are other CSBs who won't do that. And so while the Department of Behavioral Health and Developmental Services is now the lead agency in autism, there are not community agencies that are mandated to provide case management services. And so one of the comments that I would make regarding the report is perhaps if it would be possible to add that there be a mandate for CSBs to provide services to individuals with developmental disabilities, not just intellectual disabilities.
That's great. Thank you. Any other comments?
Thank you again. This is great. I work with a lot of families and children with disabilities in the law side of it, special education law. And one thing I didn't see up there is how any of the options are working with the Department of Education, because like anything, the key is getting early transition. And as you noted, the IEPs start at 14. And what I consistently see in Hanover, Henrica, Chesterfield, Richmond, either the transition services and the IEPs aren't sufficient. No fault of the schools, it's just there's nothing for them. They don't know who to work with. So I would say whatever you do with DARS and the other programs, somehow work with the State Department of Education so the schools know what resources they can use. Because once you get to 15 or 16, I mean, I have kids at 15, 16, 17 who have no skills. They'll be in public education until 22, but there's nothing for them to do. And so the transition services and the IEP starting at 14 really need to be highlighted with DARS and how they interact with the Department of Education.
Yes, I definitely found that there was a lot of information lacking and a lot of coordination between the Department of Education and DARS. Now, they told me formally that they have these collaborative agreements, and I think a lot of it depended on who was working where, and the level of expertise of the case manager at the school, or whether or not, how overloaded the DARS people were. I think often they were just completely overburdened.
Well, that's
so
exactly
I think
right. But we have people from DRS come into the IEP meetings and they'll say, hey, have you thought of this? And we haven't, because we didn't know about it. And it really
Right.
is. And we look to the schools to say, hey, what can you do? And so just whatever comes out of this, I just encourage it to somehow filter down to the schools so they know what resources are available. Because at 14, when you see a kid with autism, transition services are just going to have to be at the top of the list. And the schools, and I don't blame them, sometimes they just don't know. And it's just, you saw it, 861% it's risen in the last 15 years. And so everyone's kind of trying to understand this, but the more information the schools have, parent advocates, and special ed attorneys, more we can get, the better we can help. So just keep that in mind. But thank you again. It's great presentation.
Thank you.
Hi, Jamie.
Hi.
Thank you for your comprehensive report. I want to first of all second what Dr. Shaw had to say regarding the community services boards, because we do see that as a major barrier throughout the state because it is very different. But I wanted to address option number 6 in your recommendations. One of the things that I wanted to make sure you are aware that the Virginia Autism Council has actually been working on expanding the Virginia skill competencies so that it basically expands to adult service providers. So we're looking here with option number 6 for developing competencies for CSB staff. And so we have been working on that initiative, and we do have an individual from the Department of Behavioral Health on that work group
great.
with that effort. However, one of the things that we have found with developing competencies is it's not enough to develop competencies. It's one thing to have a document that outlines what should be done. It's another thing to disseminate that information. It's a whole other thing then to make sure people are competent on those competencies. So I would like to make a recommendation, since we're already one step down the path on this particular option, to perhaps move that forward into dissemination as well as training for those staff members.
Great. Thank you. Any other questions, comments? Is anybody awake out there? Oh, I guess I can follow up by saying I will summarize the public comments at our October 22nd meeting, and then our November meeting, which I think I should know, is November 22nd, and that I'll have to look and tell you in a second, is the decision matrix meeting where the Joint Commission votes on all of the policy options, and so those are the big days. And before they get to that point, we will again summarize the policy options and, you know, give a little brief presentation again, maybe with a little bit more detailed information, a lot of, if it's funding, how much money we're looking at, that sort of thing. And then they'll have a week to look at it over, and then hopefully be prepared to vote at the meeting. So that's all I got. Thank you.
Once again, thank you for those who joined us here this morning live, and for everybody that joined us via the webcast. Thanks again to Jamie, not only for the high quality of your work and the recommendations, but also for your willingness to come after you presented this a few weeks ago and to join us here today to reach out to a larger audience. So once again, many thanks.